Our presentation topic is oxygen delivery methods. My name is Nayeli and I play the respiratory therapist.
I'm Grace and I played the primary nurse.
I'm Anna and I play the new grad nurse.
I'm Paloma and I play the patient.
I'm Kim. I play the triage nurse and the PCP.
Enjoy!
Okay, hi, I'm Kim. I'm your triage. She's my primary.
So my name's Grace. I'm the primary nurse, and this is Anna. She's the new grad.
Okay, so we have Sarah Thomas, a 20-year-old female, full code, history of allergies to methocarbamol, and a medical history of asthma. She was diagnosed at age 10, allergic rhinitis, seasonal allergies, no smoking history, and she came into the hospital with complaints of shortness of breath, chest tightness, and wheezing triggered by pollen exposure. So her current admitting diagnosis is severe asthma exacerbation, and her perf is 60.
Okay, thank you so much. Hi Sarah, my name's Grace. I heard that you have asthma and you're feeling like you might be having a flare-up. Can you tell me more about how you're feeling?
Yeah, so my chest is just feeling really tight. I feel like I can't even catch my breath when I'm breathing.
Okay, I'm sorry that you're feeling like that. I'm just going to quickly take your vitals and your breath sounds, and then I'm going to talk to the doctor and figure out what your treatment plan is going to be like. So I'm going to start with your breath sounds. Can you lean forward a little bit, and then can you inhale? Okay. Inhale again, and exhale, and then I'm going to get some in the front. Inhale, exhale, inhale, and exhale. Perfect, thank you so much. And then I'm going to quickly take your pulse. Okay, and then we have you hooked up to the continuous oxygen monitoring. So it sounds like when I took your breath sounds, I was hearing a lot of wheezing and crackles, which is consistent with the asthma flare-up that we suspected earlier. So your vitals are also showing that you have an elevated heart rate and respiratory rate. So I'm going to talk to your doctor, but in the meantime, I'm just going to make sure that you're sitting all the way up to get you the most comfortable. And I'm also going to get you started on nasal cannula supplemental oxygen. So I'll be back in a little bit to let you know what your treatment is going to be like. So during an asthma exacerbation, the patient is going to be experiencing inflammation, mucus buildup, and muscle tightening, which is causing her to have trouble breathing. Smooth muscle bronchoconstriction and airway inflammation is also occurring, which results in the airway occlusion, which is further impeding gas exchange, and that's some of the patho behind asthma.
Okay. Hi Grace, I'm Dr. Kim. I'm your PCP for this patient. So I just reviewed Sarah's chart, and based on what I saw, I'm just going to put in the order for albuterol. So I did page the RT. They should be down to administer it. I'm also going to put in the order for IV prednisone. So you can go ahead and start that once it's in. Once we have that going, let's also get her on continuous pulse ox, which I see that you already have it. Let's also continue with spirometer. And let's get another perf. Let's also get some blood work for another ABGs, and then just let me know if there's any changes.
Okay, thank you so much. I'll let you know how Sarah's doing.
Thank you.
Hi Sarah, my name is Nayeli. I'm going to be your respiratory therapist for today. I'm going to be giving you your albuterol treatment through this mask. It's going to be given through a mist, so make sure that you breathe deeply every time. And this is going to basically help you open up your airways and help you breathe a lot easier, okay? I'm just going to go ahead and put this on.
Okay, so over the next few hours, symptoms worsened significantly despite administering medications. The patient's perf dropped to 30%. The patient was transferred to the ICU. The patient's ABG levels were, the pH was 7.3, the PaCO2 was 50, PaO2 was 62, bicarb was 26, and SpO2 was 86%.
Hi Sarah, welcome to the ICU. How are you feeling now?
I just feel like I can't breathe now at all. Like my chest feels really tight. I feel really sweaty. I just feel really tired.
Okay, I'm sorry you're feeling so uncomfortable. I'm going to check your oxygen again and then also get your peak flow rate. So can you just breathe into this? Okay, great, thank you. So it looks like compared to your baseline, your peak flow rate is only 30% of what it usually would be when you're not having an acute attack. So this does put you into the category of a severe exacerbation. We also got your blood gas results back, and it does confirm that your lung condition is worsening. I'm going to talk to Dr. Kim in a moment to see how we're going to adjust your treatment.
Okay. So the reasons that my symptoms have worsened is because during a prolonged asthmatic attack, the air becomes trapped behind the narrow airways, which causes the hyperinflation of my lungs. This means that the amount of air that I can breathe out in 1 second is decreased, and so the severity of the symptoms worsen in order to maintain the ventilation and the gas exchange that is occurring.
After speaking with the doctor, we would initiate high-flow oxygen via a non-rebreather mask. If Sarah continues to have difficulty breathing, show signs of fatigue, her oxygen remains low, or if her carbon dioxide retention becomes a concern, a BiPAP can help reduce her work of breathing and improve ventilation. If Sarah's symptoms do not improve with the BiPAP, and if she shows signs of respiratory failure, we would use a intubation or mechanical ventilation.
In severe asthma, bronchoconstriction, airway inflammation, and mucus plugging can significantly obstruct their airway, making it difficult to exhale effectively. This leads to air trapping and an inability to expel carbon dioxide, causing hypercapnia, which is a hallmark of ventilation failure. In life-threatening asthma exacerbations, CO2 retention and respiratory muscle fatigue can worsen, leading to both ventilation and oxygenation failure, but ventilation failure is the prominent concern due to the inability to move air effectively.
The team is working together to help Sarah breathe easier. They've developed a treatment plan to address her current symptoms, and they're making sure she understands how to manage her asthma in the future.
Hi Sarah, my name's Anna. I'm a new grad nurse. Now that you're feeling better, your breathing's more stable, and we're getting you ready for discharge, I wanted to talk to you about your asthma and how we can prevent these attacks in the future. It's really important for you to understand your triggers, like the pollen, which set off the symptoms that you were experiencing earlier. Do you know about your triggers?
Yeah, so pollen and dust seem to make it worse. Sometimes they'll make my asthma attacks flare up, and I try to stay inside, but sometimes I just forget on these pollen days.
Yeah, that's good to know. Avoiding these triggers is key. I'll also go over how to use a peak flow meter, which is a small device you can use at home to track how well you're breathing. If your numbers start to drop, it's a sign to start your asthma action plan early, which can help to prevent a serious flare-up like this one.
Okay.
I also brought you a pamphlet here. And it just has some more information regarding asthma for you to look at. So here is how asthma affects your body. Within the lungs, there's inflammation and increased mucus production and muscle tightening that causes you to, it's harder for you to breathe. Okay, and then some signs and symptoms that you're familiar with are listed here, and also ways that we can tell how severe the exacerbation is and what to do. Additionally, there's some more information about the monitoring devices, like the peak flow monitor that I was mentioning before, and the pulse ox that allows us to read how much oxygen is in your body, and the spirometer, which allows us to measure how much you can breathe in and out. Okay, and also some medications listed as well that's also part of your care plan that we had for you earlier, and also some instructions on how to use an inhaler. Do you have any questions about how to use an inhaler? I know that you were familiar about it before.
Yeah, is there just any changes to how I'm using my inhaler at all?
How long are you holding in the solution for when you inhale?
10 seconds.
10 seconds? Okay, 10 seconds is good. Okay, and do you have any other questions for me today?
No. So how many times do I have to use it? Like, do I just pump it once?
It just depends on how you feel. Like, if you feel like you're still having difficulty breathing, then you can take another puff of it. Okay.
Okay.
Yeah.
Thank you. And then if these symptoms worsen, then I can just go ahead and come back.
Yeah, come back, and then we will the process of your care will be similar to what you experienced today.
Okay. Sounds good.
Okay, and that's it. Oh, thank you.
Okay, so to recap our video from the beginning, at the ER, Sarah was feeling some mild symptoms of an asthma flare-up, which prompted her to seek treatment.
After the primary nurse assessed her, she was put on a nasal cannula. The patient continued to decline after getting the albuterol and prednisone treatment.
This was demonstrated by the worsening AVGs and worsening PFR of 30% compared to the 16% upon arrival.
The patient was transferred to the ICU, where she was placed on a high-flow oxygen via a non-rebreather.
If she would have continued to decline, the next interventions would include BiPAP, mechanical ventilation, and intubation. Thank you.
Thank you.